A veterinarian is legally empowered to use a human generic product anytime they want to. There are no limitations other than having a valid veterinary client-patient relationship. And ideally, you can't meet the needs of your patient with a veterinary-approved product, but that's not that important. There are, however, some concerns. I'm going to remind the practitioner that a human generic product has been demonstrated to be therapeutically equivalent to the human pioneer product, or it might be another human generic product, but there's been an approval process that demonstrates that therapeutic equivalence. That therapeutic equivalence has not been demonstrated in the animal or in the species in which the drug is being used, for example, a dog. Further, while it might be nice to assume that, and I'm going to use as an example cyclosporin, we have Atopica, which is the pioneer drug in animals, and we have Neoral, which is a pioneer drug in people. One cannot assume that Neoral is going to behave the same as Atopica in dogs, and therefore certainly the generic Neoral, human generic, is not going to behave the same as Atopica does in dogs. But it goes even further. We have data from our therapeutic drug monitoring service that suggests that generics behave differently in animals. So for example, human generic A will behave differently than human generic B in animals. And the problem is that veterinarians may dispense or they may prescribe generics. The pharmacy that uses the human generics may use the cheapest human generic. They may change. And that's not really an issue in people because that therapeutic equivalence has been established. But if a client uses, for example, zonisamide generic in humans and the pharmacy changes to a different manufacturer of generic zonisamide, that zonisamide may not behave the same in that patient, and therefore we may see a difference in plasma drug concentrations. So what I do encourage is if the veterinarian is using a human generic and they've got it in their hospital, that they make sure that the manufacturer is always the same, and if it changes, recognize that there may be a change in their patient. If they're prescribing it, the client talk to the pharmacist and be asked to be told if the manufacturer of the generic product that the pharmacy is using has changed. And of course that becomes more important for drugs that are potentially life-saving, like anticonvulsants. The temptation is always to use them because they're cheaper. There is a problem, and that's a major disincentive to veterinary manufacturers of drugs to go through the approval process for a veterinary drug, because it's already difficult for them to recoup their dollars because the population is much smaller. We have fewer animals with fewer dogs in the first place, fewer dogs with congestive heart failure, fewer owners are willing to treat the congestive heart failure, and so it takes them much longer to recoup their dollars after they've gone through the approval process. And so one of the points that I always try and make is, from an ethical standpoint, I like to, whenever possible, support the veterinary manufacturer because they're not nearly as lucrative as we probably think they are. And I like to encourage them to consider approving drugs for animals, because if they don't support the science, then who will?